to really force the government to take responsibility for what they did.
Jean-Pierre Daubois is the main plaintiff in a request for a class action lawsuit against Quebec government health authorities on behalf of all residents of public long-term care homes that experienced COVID-19 outbreaks during the pandemic's first two waves. The lawsuit would also include family members of residents who died between March 2020 and March 2021. His 93-year-old mother, Anna José Maquet, was one of those people. She died on April 3rd, 2020, while at CHSLD St. Dorothy in Laval, north of Montreal, where 101 residents died during the first wave.
My mother choked on water at 6:30 a.m. that morning, and by around 9:30 or 10 a.m., they put her on a protocol. They called it a respiratory protocol. But what we found out, it was not really a respiratory protocol. It was a protocol to end life without pain.
The class action request alleges that the conduct of health establishments was faulty and negligent and is the direct and probable cause of the outbreaks. At least 5,347 deaths occurred in CHSLDs within a year of the pandemic.
They were leaving the elderly to their fate.
The lawyer leading the suit says the authorities had delayed implementing the Quebec plan to fight a pandemic adopted in 2006.
And if this plan had been launched as it should have been in January, when the menace appeared, we would have had a window of opportunity through which we could have prepared the healthcare system much better than what we did.
The judge can take up to 6 months to decide on whether they'll authorize the class action. There are around 20 defendants in this case, including the Quebec Health Ministry, the CIUS and CIS, the Regional Health Board, and Quebec's previous and current public health director. Authorities say they can't comment as the case is before the courts and will present their counter-arguments on Thursday and Friday.
It's one of the biggest tragedies that the province of Quebec has seen. We're potentially talking about a very large class action with thousands of class members.
If approved, the class action would seek $100,000 per deceased victim, $100,000 for their spouse, and $30,000 for their children. $40,000 would also be claimed for each resident living in a CHSLD during that time period.
Made the necessary changes in the healthcare system that need to be, and have the measures put in place and ready.
In Montreal, Alyssia Rubertucci, City News.